This is RJ Manasa from Fever FM, and if you've heard my show, if you know me at all, I'm somebody who always thinks having a good, interesting conversation with a doctor is always helpful, always informative. And today, to have one such conversation, we are with Dr. D. Nageshwar Reddy, who is a very renowned gastroenterologist and also the chairman of AIG hospitals. Hello, sir.
Hello.
Welcome to the show.
Thank you.
And how are you doing, sir?
Fine, thank you.
And sir, whenever I meet doctors, especially after COVID, first thing we do is we thank them because all that you people did for us, my God, I mean, that's unimaginable, and thank you is never enough. And now moving on, sir, I am somebody who comes from a family with extensive history in cancer. So I know, early detection and awareness about cancer is very important. And also people get very scared, they just hear the C word and they go like, oh my God, what is this now? What will happen? So we are trying to create awareness, especially about colorectal cancer, thanks to AIG, and their initiative #Care4Colon. We are here talking about colorectal cancer. So to start with, sir, what is colorectal cancer exactly, and what would be the symptoms?
Yeah. So colonic cancer, or colorectal cancer as it's called, is a cancer which occurs in the large intestine.
Yes.
Now the large intestine is the last part of the intestine where what we eat as a food comes as a residue and
Right.
goes off as a fecal matter.
Right.
So this last part of the tube is called the large intestine. It has two parts, the colon part and the end part is called the rectum part. So that's why it's called colorectal cancer. So cancer occurring in this area is extremely common. In fact, in the Western world, it is the third commonest cause of cancer, and India also is increasing rapidly.
Right.
The reason why these colon cancers are very common, at least in the Western world, was because it's related to diet, obesity, lack of exercise, smoking, and of course genetic factors. These four factors are the reasons why colorectal cancers are very common. In India, where diet was predominantly vegetarian based, we used to have less of this. But now as we go into fast foods, more of red meat, more of smoking, we are starting to see increased number of these colorectal cancers in India also now.
Right.
The symptoms of these cancers are quite obvious, and that's the reason why we also call this a curable cancer, because if you come in the right time, we can cure the patient completely.
Right.
The symptoms are usually in form of altered bowels. So somebody who's having one motion a day starts having twice a day or doesn't have it for 3-4 days. This is called altered bowels.
Right.
So alteration in bowel habits. Second thing is bleeding per rectum. If we have blood per rectum, this is an alarm sign, and people should immediately see the doctor, because everybody thinks it's only piles, they don't come, but they don't realize it's cancer. The third symptom is abdominal pain, which is usually colicky type. It's not a constant pain.
Right.
You get squeezing pain coming in waves going off, and each time you get a squeeze, you pass like motion, then you feel better. So this type of abdominal pain is very common. Also, people become very weak because they're losing blood in the stools, and they become anemic. And of course, there's some weight loss which is there. So all these symptoms together are quite obvious, and very often they all come together, all the symptoms. So if anybody has the symptoms and within 3 months of having the symptoms consults a doctor, the cancer is still in the early stage where it's totally curable.
Right. And I was just telling your staff that my mother is a colon cancer survivor, and she was stage 2, and we saw how curable it was because we went, got the test done, immediately got the surgery done and chemotherapy done. So it's nice to know that, when early detection happens, it's, there's a good chance of a patient to, get cured. And so I want you to tell people that it's curable, because the second, they hear the C word, they say cancer, oh, is it curable? There are so many doubts about it.
I think in general about cancer, this wrong notion that once you have cancer, that's a terminal, death rate or something is not right, because many cancers are curable now. For example, lymphomas.
Yes.
They're all curable cancers. Many leukemias, especially in children, are totally curable. And colon cancer is one such cancer which is also completely curable. In general, any cancer which is detected in the early stage can now be cured.
Right.
We have advanced a lot, not only in diagnostic techniques, scannings and so on, but also in our genetic techniques, where we can actually make a diagnosis very early and give targeted therapy.
Right.
Each cancer can be genetically studied and a targeted therapy can be given. So I think in general, many of the cancers are curable. Many are where you can give them long life now using treatment. It's only very terminal ones which spread everywhere that come to us that we can't do much. So I think the word cancer should lose its fear now. It's no longer.
Yeah, I totally agree. I totally agree. And also, so moving on, like they say, prevention is always better than cure. Are there any preemptive measures, that one can, abide by during their daily life just to avoid colorectal cancer? Sir?
Yeah. So I think here there's some very important aspects of how you can prevent colorectal cancer.
Sir.
The first important thing is exercise.
Yeah.
This is surprising. I'm not talking about food and so on. I'm talking about exercise because this has been shown that if somebody who's physically active,
right,
you reduce the incidence of colorectal cancer by 50%.
My God, okay.
Now, the colorectal cancer occurs in a sequence when this first comes as a polyp and then becomes a cancer, so on.
Right.
These polyps don't come. So, if you exercise regularly, at least 150 hours in a week, then your chance of getting colorectal cancer is extremely small.
Right, sir.
Number two is food habits. In general, high fiber food, more vegetarian food is good.
Right.
Red meat is a no-no. Red meat is the one which is very closely linked to colorectal cancer, and one should, even if you're going to take red meat, stop eating red meat, and that's a lot of benefits in that. Smoking is another one which is closely associated.
Yes,
so people who stop, if you're a heavy smoker also, if you stop, you still have some chance, but it comes down dramatically. And the fourth important thing is this cancer screening that we do now.
Yes.
So you can actually do this by two methods. One is you can get a colonoscopy done once in 3 years to see if any polyps are there and these are removed so cancer doesn't come. Or you can get a simple stool test to see if there's blood in the stool.
Yes,
These are called occult blood stool tests and they can tell you whether there's a potential chance of cancer. So just annually, even once in a year, you can do this test to actually detect very early cancer and prevent progression and you can get cured.
And doctor, any specific particular age group, people should be more careful about getting colorectal cancer?
So we used to think that colorectal cancer occurs only in older people after 65 years of age, but this has changed now. We are seeing it a lot in younger people. So generally, there's no age exempt, but anybody above the age of 35 years can have colorectal cancer. So you have to be careful about symptoms, even if you are only 35 plus, if your symptoms are there. Especially if the family history. There's a hereditary type of colorectal cancer, which is called the Lynch syndrome, described by Dr. Lynch. So it's called the Lynch syndrome, where there's certain genetic abnormalities which are present in the families. And some of them have ovarian cancer, breast cancer. So in the family, if you have ovarian cancer, if you have a breast cancer, then chance of a colorectal cancer also is high and you have to be very careful.
Right, sir, right. And we were talking about colonoscopy. Any other detections or way of getting it detected? I personally had this experience wherein we had to do a series of tests for it to get detected. I mean, doctors couldn't tell why her HB was like 6.3. So any particular detection
there are many
method?
tests. There's a battery of tests. For example, we can do a marker in the blood called CEA, that is calcium-embryonic antigen marker, which gets elevated. But these are a little crude tests, they tell you very late. In fact, we now have what is called liquid biopsy, where we can take a blood sample and then some abnormal cells, cancer cells from the colon are actually circulating in the blood, we can detect them. But the easiest way is to do a colonoscopy because you can see the colon. Now we have a very high-end colonoscopes which magnify, and they're called image-enhanced colonoscopes. The image is also enhanced very much, so we can get super pictures and very, very early stage can be detected.
Right, sir, right. The question is not here in the bank, but I always ask whenever I meet somebody, who treats cancer, the importance of counseling, because a lot of people don't give it enough importance and go for counseling because it does play on your mind a lot. And a lot of doctors say it's got to do with your mental strength a lot.
Yeah, so I think there is also evidence that willpower has a role to play in how you resist the cancer.
Yes.
And even if you get cancer, if you have good willpower, you survive better. These are good survivors. So there's counseling is extremely important. Counseling not only for the patient but for the family. And many times we find that the families are more distraught in cancer patients. So cancer patient itself sometimes takes it well there. So it's very important to realize that not all cancers are same, that you have curable cancers. So it's very important to explain to them. Another thing which is not done in our country, I think, which is also important, is sometimes be very frank with the terminal cancer patient.
Yes.
In the Western world, we have to tell the terminal cancer patient that, okay, you got this is your lifespan, because whatever lifespan he has, he wants to live in a way he likes to live.
Right.
So it's better to warn him. We don't do this in our country, but I think that also is an important other aspect of counseling.
To program them accordingly, yes. And so it's been such a helpful, informative conversation for us, but I wouldn't wrap it up without a message from you. For all our listeners and viewers, if you were to give out a final message, what would that be?
No, my final message would be that most cancers are preventable, especially colorectal cancer. It comes down to a simple lifestyle changes. Healthy lifestyle, eating healthy, exercising healthy, avoiding things like smoking and too much of alcohol are all sufficient to decrease your chance of getting cancer, and this decreases by 50%.
Yeah, this is something we all need to remember, especially people from my generation. But sir, it was really, really helpful. Thank you so much. This is RJ Manasa with Dr. Nageshwar Reddy from AIG Hospital. He's the chairman himself who's helping us out to create awareness. This is #CareForColon with the AIG Hospitals.